Okay.
Here we go. Ladies and gentlemen, family and friends, welcome to the Hope Rising Summit 2020, September 26th to be exact. Glad to be here with all of you. I want to introduce my friend, Dr. Lisa Firestone, who is a clinical psychologist, author and director of research and education at the Glendon Association, and she studies suicide and violence as well as couples and family relations. Dr. Firestone is the co-author with Dr. Robert Firestone and Joyce Catlett of Conquer Your Inner Critical Voice, Creating a Life of Meaning and Compassion, and Sex and Love in Intimate Relationships. She is also a great family friend of mine who we've known for the better part of 20 years. Hi, Dr. Firestone. How are you?
I'm good. How are you doing, Kevin? It's really good to see you.
Doing well. It's great to see you as always. Dr. Firestone, I want to go down with some questions I have for you and just kind of have a general conversation about suicide prevention, how you got into the field, things of that nature. So can you tell us a little bit more about yourself and the work you do?
So, Kevin, the work I do, I'm a clinical psychologist, so I see clients both in person and remotely, especially remotely. At this point, I don't actually do any in person during the pandemic, but because we have real family members and we have to be careful. But I'm a clinical psychologist. I also do a lot of work on suicide prevention because it is really important to me. And I've been involved with the American Association of Suicidology for over 30 years. I think it's getting closer to 40. I did my dissertation on developing an assessment instrument for assessing suicide risk. And I've been involved with, through the Glendon Association that I work for, we've done, walks for Suicide Prevention Week with AFSP. We do free webinars every September on suicide prevention. In fact, ours is tomorrow. And we just, do a lot of training also for professionals because, everybody says to people who are, at risk, well, get to a therapist and everything will be fine. But we want to make sure when they get to that therapist that they actually know about the things that work and what's helpful, and that they can actually provide that help. So that's the other piece of work that I do.
Wow, fantastic. That's a great body of work over a great many years. It's fantastic that you've been doing it for so long and that you care so much about the field in general, which is beautiful. So I have to ask you, what got you into suicide prevention in the first place, in mental health?
Well, two things actually did. I mean, one is that when I was in my late teens, I had a close friend who was actually like a mentor to me. She was a bit older and had been in kind of that role. And she made a very life-threatening suicide attempt. And that was, she survived very luckily. And I'm really glad, as I am, that you survived your attempt, Kevin. But I was really, it caught my attention, let's put it that way, that this is a real issue, that people, even who, can seem like their life is going okay, can hit a point where something gets to them and they can spiral into that kind of state. And that's the first thing that got my attention. The second thing that got my attention is when I saw my very first patient as, a student in training. She had made 6 prior suicide attempts, 3 while in the hospital. So, and when I talked to my supervisors, they didn't have a whole lot to say about how to deal with the fact that she was feeling that bad again. And, that was really concerning to me, and I did, and we got through a year of therapy together and she was doing a lot better. She got on some medication that really helped with her depression. But, it was a difficult and, trying time and so that got my attention. And then lastly, our executive director of the Glendon Association at the time, the person who started the Glendon Association, was flying on a plane. He did political mailing. He had a company that, in the days when computers took up 2 rooms, was able to sort out data to, what kind of mailing to set to what kind of voter potentially. But he ended up sitting next to the then Surgeon General, C. Everett Koop. And what Koop said is, we need a way to assess suicide risk. As the government here in the United States, we have responsibility for all those people in the armed services. We have responsibility for all the people that we incarcerate. How can we tell who's at risk so that we can help people? You know, besides even for the general population, for specific populations that they're overseeing. And we need an instrument. And so that's what prompted me to do the research I did on suicide risk assessment.
Wow, amazing. Doctor, you and your father, Dr. Robert Firestone, who's an acclaimed artist and the author, work together daily. Can you tell us about your relationship with your dad and how that book, Conquering Your Inner Critical Voice, came to be?
Yeah. Well, my dad being a psychologist, I would listen to his conversations about colleagues from the time I was very young. So I got interested in psychology, decided this is what I wanted to do when I was 10. So I did definitely emulate him. It turns out that I've incorporated what my mother did too, which was teaching, because now I also do a lot of teaching to, you know, therapists about different approaches and techniques, and particularly about suicide prevention. So it's a close relationship. My dad's a very unique person. As you mentioned, he's also an artist. He is doing a second edition of his book, The Fantasy Bond, right now that he's working on. And he's going to turn 90 tomorrow. So he's still a very active person and very interested in the field and in helping people to this day. So we have a close relationship. And during this pandemic, me and my family, my siblings are, you know, providing a situation where he's safe, so that he can be really protected just because of, you know, the risk factor of his age and all of that.
Yeah. Well, please wish him a happy 90th from all of us. That's amazing that he's been doing this work for so long, and it's beautiful that you followed in his footsteps and in your mother's footsteps. That's so perfect. Doc, I have to ask you a question about suicide in particular. What do you think is necessary to change in the world of prevention today to finally see the rates of suicide decline by a significant amount?
You know, there's so many points of entry. You know, if we'd start at the beginning, we'd do better child rearing, because we do know that adverse childhood events, you know, having a difficult early life, you know, doing those very first years can set the stage for higher risk, you know. And, you know, to do that, I think we really have to help make people aware that if you don't feel the full pain of your childhood and make sense of it, you're likely to repeat it with your children.
Mm.
So it's really important that people explore what happened to them and make sense of the story of what happened to them when they were young. That if you can do that, you can be a better parent. And what's more important than being a better parent? If you're going to have children, there's a responsibility to be a good parent. And it's difficult, right? It's not the easiest thing to do. And I think that's important work. So I think if we're going to do primary prevention, if you will, starting at the beginning, we would help parents do better. And partly to do that, we would be more supportive of parents. We'd make being a parent easier instead of putting parents under so much stress that, you know, they don't have the time and energy to be the best parents they can be. I also think ideally for kids need a lot of caring adults in their life. That's what makes it a protective environment for them. So it helps if there are other family or friends involved that can be there as somebody your child could talk to. So, you know, especially as children hit adolescence, you know, sometimes they don't want to talk to their parents very much. We can all remember being an adolescent. But, you know, if there's other family or friends or somebody who's close that they can speak with, that they feel close to, that they have access to, it matters. So I think also being supportive of kids as they're growing up, providing this sort of protective shield of more caring adults in their life. So it's something to cultivate. If you don't have family, make a family of choice. You know, be there for your friends' kids. You know, let them be there for your kids. I also think we fight stigma around mental health issues, you know, so that asking help and going for the help that you might need is easy, accessible, and considered a strength, not a weakness. You know, I think we have to think differently. We all have mental health struggles. You know, life is hard at different times for everybody, and we need to make it easy for people to access care when they need it. And one, you know, to come out of this pandemic is a realization that remote therapy can be very effective. So we can reach people in underserved areas more doing, you know, by being able to do more remote help and that to people who need it, you know.
Absolutely.
city where, you might have many people you could access. It's what if you live in a really rural area where there aren't a lot of mental health access. Um, and also that we have to make it affordable to people. We have to make this just as important as physical health care. And we have to make physical health care also accessible to everybody in this country. I mean, that's just the basics of what we need to do to be a humane society. So, those are some of the things that I think that would be preventive. I also think we really have to, as professionals, be humble and learn and be always open to learning more about what works and what's helpful to people and what isn't. A lot of psychological associations and professional organizations fight it when we try to make new requirements for education for professionals. And, they say, we already know this. I think we need to be a lot more humble, because it isn't until about the last 15 years that we've known anything about what worked in preventing suicide in terms of treatment. And we still don't know nearly enough. We do know about some things that work actually now, but not everybody gets training in those things. So that's the issue of getting to help. You want people to get good help, not insufficient help or help that's not going to be helpful at all. So, let's find out what works. So we have some idea now with adults about what works, but we don't have a lot of good data as what works with kids. And we need more of that, and we need to put some research dollars behind that. And especially, I think, following, this crisis that we've had with the pandemic, where, for young people growing up today, they're going through a very bizarre situation. I was just on the phone with a college student that I see, and, he's dealing with, he would be the captain of his team sport right now for his college. Now he can't even play, right? And he can't be outside. And, that's a big part of his mental health regime, is being physical. That's what he does to blow off steam.
Yeah.
We're going to have a bunch of young people that are suffering, or, young people who are home with their parents, or they're, not being able to go to high school and connect with other kids. And, I feel the worst for kids that are only children, because they have no kids to play with. And it's just hard. Adults are not the same thing, when you're a kid, as having a fellow child there to play with.
Yeah.
I mean, parents are doing the best they can, but it's just really hard.
And your points are extremely valid and important. I'm of the opinion that we should be teaching our grade school children from 4th grade on up suicide prevention and mental health and well-being to their comprehension level. I think that we made a huge mistake in this country and around the world by waiting so long to teach them any of these tools. So by the time they're 17, 18 years of age and they have a mental health crisis, they don't know what to do. And certainly with my family, that was the case. I turned 17 and a half. I had a complete mental breakdown. Nobody knew what to do. By 19, I was suicidal, and I went off that bridge you see behind me in an attempt to take my life. Thank God I survived. And so not only that, but I also think, like you mentioned before, making parents aware of these things as well. And you made a great point there. I'm also of the opinion that parents, before the child leaves the womb, the parent should be debriefed on mental health, mental wellness, mental acuity, brain, mind, behavioral, and spiritual health, and suicide prevention. They should be given these tools so that if their child gets to that point at any age, they know at least some kind of starting pathway to getting them to a better place. Whereas with my family, it was Kevin erupts into mental health fallout. Family doesn't know what to do, and then I almost died because of it. And they were there to not be able to do anything about it and only receive the bad news. So I really have to say your points are right on the money, hitting the nail on the head, as they say. Doc, what are your thoughts? Now switching gears here for just a moment. What are your thoughts on gut to brain health and the role of proper nutrition and what it plays as it affects moods, stabilization, and mental well-being?
Yeah, I think that's really an important area, Kevin, that we haven't known much about until recently. Nobody ever suspected that what's going on in your gut is going to affect your brain as much as it is. And we now know it is a great deal, right? So I do think that, nutrition and understanding what's going on and checking out those things when somebody's going through a mental health crisis are incredibly important. I mean, it'd be better if we just were feeding our kids all healthy food from the beginning, right? And eating in balanced ways. But some people need different diets, right? Because of their own metabolism and their own, what's going on in their particular brain. So while we would all do better to eat a lot healthier, and that would make it a good, starting point for all kids, I think we also need to, when somebody is struggling, be willing to evaluate that and try different things along the lines of some of what we've realized about how much gut health affects things, which I don't think we had any real idea before.
We didn't. And now there are books today by Dr. Hyman and Dr. Cole and Max Lugavere, all about gut to brain health and the ratio between the two, that your gut biomes are directly connected to your brain's chemistry. And if your gut biomes are poor or your nutrition is poor, you are directly affecting the functionality of your brain and your mental well-being, which is fascinating. It's also connected to impoverished areas or areas of strict poverty and the level of violence in those areas. And people don't recognize and don't realize how serious gut to brain health really is, and how if it's tackled in things like grade school and high school, and we're not feeding our kids mush and just food that is not good for their brains, that we could be actually transforming their mental health by feeding them more greens, more healthy fats, and more healthy foods in general that are whole foods, true foods, and real foods, as opposed to things that come from plastic wrappings or boxes. Things that come from the ground are generally that are without pesticides, are generally the healthiest foods we can find on this planet. And that's not to say that you wouldn't find healthier foods in meat or in other areas, because it does depend on the person. And I think that we have all these fad diets in the country and around the world right now that are dangerous. But if we look at the truth behind your gut biomes and find out what foods help what people, yes, it's different for every person, but there is a baseline of what true, healthy, real, honest, whole foods are.
Right.
So,
I agree with you 100%. And, there was an interesting study done by a colleague of mine, Adrian Rain, in Mauritius, which is an island, so it's a contained space, where you can study people over lots of years. And, they gave kids, they divided the kids up and they made them a match sample. And half of them got a little box of juice that they drank every morning. They all got a box of juice, actually, but some people just got juice. Okay, so not such a great healthy food. The others got juice that had omega-3s in it, what we get from fish oil.
yes.
And they did this for 3 years when they were quite young. And then they looked at who committed crimes, when they were older, when they were in their 20s. Guess what? The kids who got the omega-3s when they were kids, no crimes. The other group, much more. So it's just interesting. It's not that every kid in that group who doesn't get it is going to do badly, but it helps every kid if we gave it to all kids. It won't, there's no negative side effects of eating healthy food, right?
That's right.
So we don't have to worry about it. It's not like giving a medication to everybody when not everybody needs it, because that's going to have side effects. We're talking about eating healthy. There's no kids who would do badly with that.
That's right.
And everybody's probably going to do better in terms of brain health and physical health. And that's just, it seems like a no-brainer to me. Same thing with being active. We should encourage kids to be physically active. And we don't still do enough of that, because that's also good for your mental and physical health with no negative side effects, only positive side effects.
And when you couple the two, eating healthily and exercising from a young age, you have a better mental acuity and mental health as you get older. And you're less aggressive, you're less irritable, you're less moody, and you're potentially less dangerous. So it all adds up. Doc,
you do this with all kids too. We'd save enough money in our healthcare system to be able to really provide healthcare to everyone. That's another thing.
If we just fed our kids the right foods, we would save more money and have healthcare for all. That's right. Fantastic point you make. It seems so rudimentary. I wish our governments would get in line and follow suit. So Doc, let me ask you, you're a married woman, yes?
Yes,
And
for over 40 years now.
over 40 years. Wow. Margaret and I have been married for 13 years, together for 16. So we're going to try to catch up to you as soon as possible.
Okay.
Um, what are your tips to a long lasting and good to great marriage?
I believe there's a number of things that go into it. I mean, it helps to select somebody who is open and to feedback, really cares about you, and can really have your back. I think you did really well. I think, I think you did a great job. I love Marge. And I think I've seen the effect on you, because you knew Marge when I first met you, but you weren't married yet. And now you are. And I've seen both of you over the years. And I've seen that you've gone through, all the kinds of stresses that a relationship's going to have, the ups and downs of each person, but, that you have done it together. Yeah. And I think that makes for a really strong relationship. I'm a real believer in honesty in relationships. I think that's a hugely important thing. It's one of the traits that my husband has that I really appreciate very much, among many others. But, it's somebody who, picking the right person does matter. And then building on that by being honest, having honest communication where you can really talk to one another. I think you have to have a spark between you. So I think that matters, but it can't just be that, that kind of huge firework spark that then is also going to lead to a lot of conflict later on. So sometimes when you come together with somebody where your defenses fit together, there's big sparks at the beginning, but then doesn't go well over time. But to be able to maintain that, to be able to still light up when you see the person years later, really important. And that comes from building, a real caring relationship where you're still doing things together, sharing time together. Relationships can't exist in a vacuum. You got to make time and attention for your partner to do fun and exciting things and to try new things together. I think that's really important. Dan Siegel and I did a e-course on relationships. And the first thing he said you need to have a pheromone match. These are chemicals that we're not aware of, but if you can't be next to the person when they're sweaty, it's not going to last. He says you should run up and down the stairs 10 times if you think this person might be the one. Stand next to them, inhale deeply, and you'll know they could be the one. So you got to start with that. That you can't change. That's probably something that has to do with our animal history, nature. There also has to be a temperament match to some extent, where things you do to make the other person happy don't make you miserable, and the things they do to make you happy don't make them miserable. It's really important that you have some fun shared activities that you enjoy with each other. So somebody who's a total introvert with somebody who's a total extrovert, that's going to be tough, to make that work in the long run. Yeah. You don't have to be exactly the same, at all, but, where there's some commonality. And, the other parts I think come from how you treat the person. And it helps if each person can develop their own sense of inner security so that they can be a more secure partner in terms of their attachment with their mate, so you can have their back. What people want partly is they want to feel safe with their partner, like they have your back. You want to feel seen for who you really are, not better than you are or not worse, but with, somebody who loves you with all your, all your rough edges. And then you also want somebody where you feel soothed when you're distressed. And that should be, both people should be able to soothe each other when they're distressed. And that's really helpful for the long run.
Very helpful, crucial, in fact. And you've worked in suicide prevention, violence prevention, couples and family relations. Can you just break down your personal efforts in those fields, starting with suicide, then moving on to violence, then couples and family relations?
Sure. So our first work in suicide prevention was my dissertation, like I said, that's suicide risk assessment, and working with people who are struggling, which I did all along and still do. Some therapists are afraid to work with people who are suicidal because it makes them very anxious. And I think it's important work to do and to be in touch with people and their suffering, So And then we got involved with the teaching and training, and the film that you took part in that we made, and some training films that we made, and being involved with the American Association of Suicidology all throughout my career, and still doing that work, so that was really important. But in developing our assessment for suicide risk, what we were looking at is, what are people telling themselves? What are the thoughts in their head? So underlying our whole approach is this idea that people are basically divided. There's a part of us that wants to live, that's goal-directed, that's life-affirming. But there's a part of us that's going to be self-critical, self-hating. Its ultimate end can be suicidal. Nature and degree of this division is going to be different for each person, partly based on their early life experience. But there's also things that happen to us later in life that can tip the balance in a good direction or in a not so good direction. And so we were asking people about, what are the thoughts that they're telling themselves? And what we found is they're actually very predictive of what kind of behavior people are likely to engage in. So it's important to understand thoughts. And also, when you can identify the thoughts, then you can target interventions at those thoughts. You can directly deal with the person around the kind of thinking they have that gets them into trouble. We then became interested, okay, if that works for self-directed violence like suicide, would it also work for outer-directed violence in terms of people who get aggressive toward others? And we found that there are different kinds of thoughts that lead to aggression. They're different than the thoughts that lead to suicide, which are all about blaming ourselves and how terrible we are and how flawed we are. These are thoughts about how, other people are doing you wrong, and, other people are undermining you, and, other people are dangerous in some way. All these kinds of thoughts that if you think that about any person or group of people, you feel more justified in being aggressive toward them and violent toward them. So it's important, again, to get a hold of those thoughts, and then you can work with those thoughts in working with people who've been violent to really get through that and no longer be a violent person. So there's a whole violence prevention program that talks about, when you get triggered into an aggressive state, the thoughts that go on in your mind. And if you get on the train of those thoughts, you get pretty justified in acting aggressive. But if you can get a hold of that moment and kind of do the opposite, instead of ball up your fist, put your hands up in the air and go, this is my moment where I feel threatened. I can look at those thoughts, but I don't have to get on the train and believe them. And I can actually do things to intimate rather than violate. And it's a really interesting, I think, idea about how you don't have to go into that aggressive, violent behavior. You can do something different at those moments when you feel the most triggered. So that program had reduced recidivism by 80% in repeat violent offenders.
Wow.
Very powerful. It's done in the San Francisco jails, actually, somewhere right behind you in that picture. And, the reality is it really works. So there are things we could do. Allowing people in prison to get an education helps. Giving them more omega-3s helps. Changing their diet. But what do we feed prisoners? The worst food in the world instead of the best, which would actually help their brains get better. So anyhow, there's things we could do to, in that field. The couples work has been, and family work and understanding what impacts children, is how can we build this so that people have less negative thoughts overall, so that degree of that division is more on the positive side because they've gotten a lot of support and they're growing up, a lot of help. They've had people be really there for them. They've internalized an inner sense of security because their caretakers made them feel safe, seen, and soothed, and it doesn't have to be your biological parents. There has to be at least one caring adult who does that for you. That's why the more people you have, we're supposed to be a village taking care of kids, not, single parent, under a lot of stress and financial concerns and, now locked down at home and having to teach your kids too, among many other things we're asking parents to do. Anyhow, so, the things we can do to help parents be better parents. That's why we came up with the Compassionate Child Rearing Parent Education Program that we developed, Joyce Catlett and I. And then helping people form better, healthy relationships, because when we're in good, healthy relationships, we feel supported, our mental health gets better. And when we have mental health struggles, that person helps us. Everybody does better when they have close friends, close relationships where they feel supported. So how can we help people do that better? And that's why I really embrace that work and love that work, because, it's been so important in my own life, and it's been so important to so many people that I've worked with.
Fantastic. All of these points are very helpful and very informative, and can help anyone, change the path of their familiar relationships, their friendships, their significant other relationships, things like that. Dr. Firestone, can I ask you, as someone who clearly values lived experience, why do you see value in stories of lived experience or lived expertise, especially as it relates to suicide prevention and mental health?
Yeah, I think the number one thing is, first of all, those stories help numerous people. They help the person who gets to share their story. They help the people listening who are struggling, because it's one thing to hear a hopeful story, that you can have a life worth living after feeling like you can't, really important message, but nothing gets that across the way a lived experience story does, right? It just moves people. It's also important for people who are clinicians or working with people, because you need to really understand what it's like to be in that place. And you need to understand what's going on in the minds of people when they're struggling. Otherwise, how are you going to be effective in reaching them? Also, people with lived experience inform us about what helped, what didn't help, that we really need to know. And they also, some things that we've done for years that we think are helpful or we think are necessary have actually been really hurtful to people. And we need to hear about that. And we need to be willing to listen to people's lived experience. And sometimes we're not as sensitive as we need to be around those issues. So even on the American Association of Suicidology listserv, where we have people who are of lived experience, people who've lost loved ones to suicide, people who work on crisis lines, and people who do research, and people who are clinicians, it's the people with lived experience that keep us on track always and remind us when we've gotten off track about, any kind of stigma around lived experience. And we need to fight that stigma. So, I think the voices of always including the voices of people with lived experience is really important to keep us on track in terms of where we target, where we put our efforts, where we put, our support, where we put, our resources in terms of suicide prevention. Very, very important constituency that, we really need to listen to. And sometimes they're the most important voices in the room a lot of the time. So that's a really important part of it.
Dr. Firestone, hearing that from your lips to God's ears, and to hearing you say that as someone who's been 40 years in the field, been at the top of the field in your game, is very heartwarming to me, because it wasn't too long ago that I sat at a private lunch in, I think, Oklahoma, with some of these top suicide preventers, top clinical suicide preventers, and they turned to me and said, what do you think about this rising voice and lived experience? And I told them of my praise for it, and one of them turned and said, well, I think it's too loud. And it broke my heart to hear someone I respected as a friend in the field say something like that so callously, basically saying that only clinical minds matter. And I think that you would agree with me that that's where the mistake lies in treating people with mental illness, is treating them like they're a number or just a patient as opposed to a person. What would you say to someone in our field that still feels that way?
I would say I think you're really missing the boat. I think that I think research, I think clinical experience are valuable, but they're not the same as knowing what it's like to be in that person's experience. And if you can't resonate, and if you can't tune into that, you're going to miss so much. And you're not going to be sensitive at those times when you need to be the most sensitive. The relationship is what's important in therapy. It's one of the biggest, most important things. I remember I said that at a interview very early on in my career, and somebody said, well, it's not just the relationship. You need to know all these techniques. I'm like, yes, but no techniques are going to work if you don't have the relationship. I don't care. You could have the best techniques in the world. The person doesn't want to be in the room with you. They're not going to be helpful. And, even techniques that think that they're treating people by, if you do these specific things, they're going to get better. If you don't have the relationship, people don't stick around for those. And when you ask people in those treatments what helped them who get better, they say it was the relationship. So if you can't form relationships, if you can't listen to people with lived experience to know what their experience is like and empathize with that and really resonate with that, you're not going to have good relationships with people who are struggling. And just saying, you're a number, you have this specific disorder, so I'll give you this medicine and you take it like you're supposed to and you'll be better. First of all, it's not true, right? Yes, there's some medications that are really helpful for some things. I'm not saying there aren't, but people aren't going to take your medications if they don't like you, if they don't feel connected with, if they don't feel seen, they don't feel treated like a person,
or trust,
and they're what?
Or trust in you.
Or trust you. So why would they take your medication or do your technique or whatever? Also people have to be treated with respect about the fact that they're going to really need to manage their own suicidality. And we need to really help them with, okay, what's worked for you in the past? You specifically, not you, everybody who's suicidal, because you're different people. What helps you? What, it might not be the same thing that helps somebody else. Really helping them understand and really feeling more able to self-manage. Because, often, struggling with mental health issues is not a one-time deal. It's usually, over time, things are better, they're not as good, people are going to struggle. And you need to know how to manage your own mental health. And treating you with that respect that you, Kevin, can manage your own mental health. Here's some help. Here's some good clinicians that can be there for you. Here's some things that work for you. And that you're going to be managing your mental health. You know what I mean? Hopefully with a lot of good support. But that's what people need. And they need to be treated with respect that they're perfectly capable of doing that. You know what I mean? And when they have trusted, caring professionals who really listen to them, if you don't really listen to them, how's anybody supposed to trust you?
Yeah.
It's just like in your relationship with your spouse. If you don't listen, they're not going to trust you.
No. And why should they? So and same goes for a clinician or a nursing staff in a psych ward, a psych unit. I'll say to you this, Doc, when I was in my 9 psych ward stays in the last 14 years, the last of them being just a year and a half ago, all for suicidal ideation. It was after the 3rd psych ward stay that I found true self-awareness. In the last 6 psych ward stays, I walked myself into myself with family and friends that I need to be here or I won't be here. So it was very self-aware that I had become. But prior to that, it really was in those first 3 psych units, it was really the staff members that showed compassion, empathy, even love and care, that really got me to work hard to better balance my brain health. The ones that were rude and difficult and combative, and who didn't really belong at those jobs, they were just going through the motions. And let me be clear, I'm well aware that they've probably been through a lot. They're probably tired. They're probably over the job. I get that. But if you're over the job, don't be in it, because you're affecting the people that have to be there to live there to get better in a very negative way. And we know scientifically that when someone around us is being negative, that negativity can permeate us and make us more negative, just as someone who's around us who is positive, uplifting, and light can have that same transformative effect on us. It's almost like a reaction to their positivity or their negativity. It's very well documented that the way we act and interact with those around us affects them and their well-being. So I totally agree with you in the fact that when you're in one of those situations, as a person with lived experience who takes medication, who fights for his mental well-being, who works tirelessly, when I fall down, and I mess up and I go back off my routine and I end up back in the hospital, the last thing I want is for some doctor, nurse, or staff member to put me down for being back in the door, and falling off my routine. I need that person to lift me up and to say, I believe in you and you can do this.
Right. And you need to have that resource to support you. So, that's actually using the resource well when you know you need to be there. You know what I mean? That should be like, okay, that was really a strong, great decision, Kevin, and now let's work from here. And I like that you said loving care, because that's the taboo thing to say in my field, but it's really important. I did go to one conference. It was Women Learning from Women. It was a really interesting conference many years ago where therapists actually got up on stage in front of thousands of people and talked about loving their patients. And they didn't mean it in any inappropriate ways or inappropriate boundaries. They meant really caring, like, you deeply for somebody that you're working with, that you're trying, that you're working together in a very collaborative relationship, and it should be collaborative with them being the experts on their situation, and caring about that person. And I think that kind of care really helps people and lifts them up. And I think just saying, here's a list of things to do, or here, take your medicine, doesn't do that. I'm not saying those things aren't part of it. They just aren't the whole deal or the most important part.
And that's true. And you can find that list of things that you can act on for the person in the mental pain. And those things, or that routine they build, can really help better their brain health. But it's not going to do them any good if they don't actually take those steps into action. But they're not going to take those steps into action unless they believe, trust, and care about what you have to say. And I think that's where things changed for me. Was when my uncle came to see me in the psych unit. He came with some tough love, and he said, Kevin, your family can help you until we're blue in the face, but until and when you take 100% responsibility for the fact that you have this disease and you fight it tooth and nail, kid, ain't nothing gonna change. You'll be in and out of these places for the rest of your life. And he said that, and it impacted me. And that, along with the compassion and loving care I got from some of the staff members, changed the trajectory of my life. And yes, I'd be back in psych ward 6 more times, but I would be there of my own volition. And I think that is really the true testimony of someone who's found, lived, and stays in recovery. And even today, very well that I developed my 10-step regimen to stay stable, and I follow that till today. And when I follow up that program in any way, shape, or form, I feel it. And if I fall off too hard, I'll be back in a psychiatric hospital or worse. So I really do my darndest to stay stable and to learn the newest and most reputable, proven forms of treatment for bipolar disorder, my diagnoses, so that I can succeed, survive, and not just survive, but thrive while living with this diagnosis. Dr. Firestone, what would you say to somebody who, let's say you meet somebody like me prior to finding mental health help, and I'm going through it, and I don't know what to do, and I'm at a loss in my life. I feel worthless. What do you say to that person right now who might be watching, who needs that leg up in the world?
Yeah, I would say it's really worth in taking the chance and investing in yourself, that your life is worth it. Believe it or not, well, you might not at this moment. It's really important to get the help you need. And that might be from friends and family. It might be from professionals, but find somebody. And if you go to somebody and they don't resonate with you, say goodbye. Find somebody who does. Find somebody where you feel trust, where you feel cared about, and talk to them. And, if you try talking to one person and it doesn't work, don't give up. That's one person. Try talking to another person. I think to people who are worried about somebody, be that person who sits there with that person, who really stays with them. Be there and really try to just listen, and really try to be a compassionate presence. I think about when you've done it with people that you've seen that are upset on the street, Kevin, I've done it too. When you do that, people, feel something like, oh my God, this person actually, it matters to them. And they're there, and we're trying to get them connected to the right person, and I would say to people, it may not feel like it at this moment, but your life is worth it. And you can have, like you do today a life worth living, right?
Yeah.
And it doesn't mean you might not have struggles in the future. It might not mean that you have to take care of your mental health in various ways for the rest of your life. But you can do that, and you can make it happen. And there are paths forward. And I've just seen too many people come through crises like this, but have a life worth living. And you can have it too, even though it doesn't feel like it right at this moment. But if you find that the first person you talk to doesn't listen, find a different person. If that person doesn't resonate with you, find somebody else. You have to sometimes really look for the help that's going to really help. I always tell people they should shop for a therapist. We spend more time reviewing people on, reviewing a product we're going to buy than we do the person we're going to see with our mental health. Wait a minute. Let's pay attention, not only to the reviews, but meet that person, because they might be right for somebody else, but not right for you. That's okay. Then find the person that is right for you. And if we don't do that, we're not going to get the help we need.
I think that's right. I think you have to interview your therapist and your psychiatrist, just like they would interview you for a job. You have to interview them and go through many at a time to see who is the right person to be talking to you. I mean, it's if you don't vibe well with the person that's treating you, then it doesn't make any sense, and you shouldn't be in front of that person. You should find someone that understands, empathizes, and is compassionate toward what you're going through, so you can grow together. And that's really what that relationship is all about. And it is a relationship, the therapist, patient relationship. I don't even like to call us patients or consumers. Dr. Firestone, I like to call us citizens of hope, searching for the light at the end of the tunnel. So we're citizens of hope, trying to find a way toward a better future and a better well-being. And we're right about the time when I'm going to ask you some rapid-fire questions. So we're almost wrapped up here. But I want to go right into them. Dr. Firestone, what is your idea of perfect happiness, or do you have one?
For me, it's being in nature, somewhere beautiful, that, and being physically active, like going for a hike in a beautiful place makes me really happy.
Good.
And connecting with friends.
Wonderful, wonderful. What is your greatest fear?
Right now might be coronavirus.
Fair enough.
Among my friends.
Like,
what?
That's a lot of people's right now.
Well, yeah, and it's wanting to be able to care for my friends and family and not bring it to them too. Not just about not getting it myself.
Yeah. Which living person do you most admire?
Wow. Well, I'm going to go for my dad, because I'm pretty impressed with him as a person. And because he has a real love of people. He has that loving care response to most people. And, that's one of those things that I really appreciate about him. And you can see the effect it has on people. It changes people.
What is the quality you most like in a man?
I most like in a
man.
In a man. I think honesty and warmth are two really important qualities I really like in a man.
And what is the quality you like in a woman?
I like those same qualities, actually. I like honesty and warmth in women too.
both people. All right. What or who is the greatest love of your life?
Well, I'd have to say Ron, my husband of over 40 years, is way up there. My children are definitely up there, as are all of the children in my family that I've been involved with often since the time they were born, that matter to me a lot. And there are quite a few of them. I have a lot of nieces and nephews.
And what is your greatest passion?
I think my greatest passion is actually the work I do. And that's why I'm still so motivated after all my time in the field, because I really like working with people. When I see somebody who's right there with me, they're fighting for their lives as much as I'm fighting for their lives, it really is, like you said, a really important relationship. And I still find that process thrilling. I really do.
Dr. Firestone, we are so grateful to be on today for the Hope Rising Summit, the first annual Hope Rising Summit, hosted by the Kevin and Margaret Hines Foundation and Magellan Mental Health. And we're so happy to see you again. I wish I could see you in person. but someday soon when coronavirus gets the heck out of here. We're so grateful to have you here as a part of the conference. Thank you for joining us, and we look forward to doing great work with you in the future, and we hope you have a wonderful evening.
Thanks. I wish the best to you and Margie as well, and it's great to talk to you, Kevin.
All right, take care, Dr. Firestone.
Thanks, take care.